Have you ever wondered why your doctor ordered for a third trimester ultrasound? Hello and welcome back. My name is Joseph Tsuma, always your favorite doctor. And when you see me here, you know it is Matters Health. I'm here to bring you trusted health information wherever you are. You can follow me for simple, updated, practical, and reliable medical insights that will be able to keep you and your family healthy. You can subscribe to my YouTube channel at Dr. Wills. You can also follow me on TikTok at Dr. Itsuma. So today I want us to discuss the importance of that trimester ultrasound. But before we dive into today's topic, always we listen to some words of wisdom. And today's words of wisdom come from the book of Mark, chapter 9, verse 23. And the Bible says, and Jesus said to him, if you can, all things are possible for one who believes. Now, Jesus Christ here was having a conversation with a man who had brought his son to be healed by his disciples, and his disciples had prayed for this man, and he was not healed. And so he came to Jesus Christ with some doubts on whether Jesus Christ can actually heal his son. And he came and he was like, if you can, please heal my son. Okay. And Jesus Christ actually brought it back to him and was like, you are asking me if I can heal your son? Okay. And Jesus Christ was like, actually, all things are possible for anyone who believes. Okay. So if you believe in Jesus Christ, everything is possible. So I want to encourage you to believe in Jesus Christ because everything is possible with him. So let us dive into today's topic. So a third trimester ultrasound is an ultrasound that is done between the 28 weeks all the way to delivery. Now, this ultrasound has very many importances that we need to be able to understand. And number one is to assess for fetal growth. Now, that trimester ultrasound can help to detect for any problems with the growth of the baby, whether the baby is growing normally or the baby is underweight or the baby is overweight. Okay, what we call intrauterine growth restriction or a macrosomic baby. So it's very important, especially in monitoring the growth pattern, okay, and especially if you've been doing serial scans. So we talked about the first trimester ultrasound, the second trimester ultrasound, and now you're doing a third trimester ultrasound. You can actually look at the pattern of growth, okay, from the first, the second, and the third, and be able to make an important medical decision on whether the baby is growing normally or not. Now that one can help especially to plan interventions if growth restriction is detected or if you're having a macrosomic baby, very important here, especially when you're planning for interventions. Number two importance is to estimate the fetal weight. Okay, so you can use parameters like the head circumference, the abdominal circumference, the femur length, okay, to be able to estimate the fetal weight. And that one helps especially when it comes to guiding, especially when it comes to delivery. Okay, because for a baby who is too big, what we call a macrosomic baby, you might need to deliver this baby through cesarean section. And for a baby who is markedly underweight, you might also need to deliver this baby through cesarean section because they might not be able to withstand the contractions. Okay, so very important, especially to in making important decisions of delivery, and that one can help to avoid complications, especially that comes with large babies. Okay. The third importance of a third trimester ultrasound is to look at the amount of amniotic fluid. Okay, so we talked about too little, what we call oligohydramnios, or too much, what we call polyhydramnios. And this basically can indicate a problem either with the mother, what we call maternal complications, or it can be a problem with the fetus, what we call fetal complications. Okay, so maternal complications can include placental insufficiency, okay, and fetal complication, or even mother who has hypertension, okay, or diabetes, okay, they are at risk of actually developing too much or too little of the amniotic fluid. Now, a baby who is growing in the womb, but then they also have some congenital anomalies, Okay, they can actually, or like congenital anomalies associated with the kidneys, okay, so or associated with the gut, okay, they can actually present with oligo or polyhydramnias. And that one is very important because you're able to, and too much or too little can actually uh, uh, hamper the normal growth of the baby, and therefore you need to it can help to make important medical decisions, especially when it comes to the growth of the baby. Now the other importance is for evaluation of the placenta, and we have talked about the importance of knowing where the position of the placenta is. Okay, is it a low-lying placenta? Is it a placenta that is at the fundus? Is it a placenta? Is it posterior? Is it anterior? Is it on the walls, on the sides? Okay, very important and when it comes to be making a decision on the type of delivery. Now, the other thing that we need to understand is that, especially for a low-lying placenta, okay, when you do a second or even a first trimester ultrasound, you realize you can have a low-lying placenta, but it's possible for the placenta to move. And that's why a third trimester ultrasound is very important for you to be able to ascertain whether it's still low-lying and actually be able to help you make a good decision when it comes to the type of delivery. Okay, and then the other importance is for assessment of fetal presentation and position. Now, the fetus can has at least three main positions that you can find. Okay, so the fetus can actually present with the head, what we call a cephalic presentation. The fetus can present with the buttocks, what we call bridge presentation, and the fetus can also be present with the side, what we call transverse. Now, these positions are very important for you to be able to confirm them before delivery, because especially for transverse and bridge presentation, most of the doctors will recommend for a cesarean section, and if the baby is presenting in cephalic presentation, then that is the best position for normal vaginal delivery. The other importance is to look at the health of the blood vessels that are the umbilical blood vessels. Okay, so those are the veins and the arteries that are found in the umbilicus from the placenta to the baby. Okay, now for conditions for mothers who are either hypertensive or diabetic, okay, the health of these blood vessels might be compromised, and if they are compromised, okay, then you will end up with intrauterine growth restriction or even placental insufficiency that can lead to intrauterine growth restriction. Okay, now knowing the health of these blood vessels is very important because it can actually help you to know whether the baby is growing normally or the baby is not growing normally, and therefore you can actually as well plan for delivery, and especially for mothers who present with hypertension in pregnancy, okay, or hypertensive crisis in pregnancy like preeclampsia, eclampsia, okay, diabetes, okay, uncontrolled diabetes. Very important to look at those blood vessels because they can actually help you to make a decision on when you need to deliver this baby as soon as possible. Now, for mothers who present to the hospital and they complain that their baby are not playing very well, okay, that trimester ultrasound there are some parameters, what we call biophysical profile, that can help to be able to ascertain whether the baby is okay or not. Okay, now with biophysical profile, there are certain parameters that we look. We look at the breathing of the baby, we look at the movement, we look at the heart rate, we look at the amount of amniotic fluid, okay, to be able to ascertain, and also the tone, to be able to ascertain whether the baby is playing well, the baby is breathing well, there is good tone, the amniotic fluid amount is okay, and that one helps to reassure both the mother but also the clinician, okay, because with any discrepancy in the biophysical profile, it can actually mean that you are having early signs of fetal distress, and therefore important decisions needs to be made at this point to be able to help save the life of this baby. Okay, the other importance of third trimester ultrasound is to be able to detect for late onset of fetal abnormalities. Okay, so there are other fetal abnormalities that can actually present very late. Like, for example, a baby who develops hydrocephalus very late, okay, or a baby who develops problems with the urinary system very late. And that one can be detected in the third trimester, and therefore you can actually involve the rest of the team that are required, especially during that time of delivery, to help save this baby. Okay. Now, another importance of that trimester ultrasound is to assess the health, especially for a mother who has multiple babies, or what we call multiple gestation. Okay. Now, there's a condition that we have discussed before called the twin-to-twin transfusion, especially for babies who are sharing a placenta. Okay, it's very possible for them to be able to have twin-to-twin transfusion, and therefore one twin is not receiving enough blood, which means they are not receiving enough nutrients, and that one can actually lead them to have reduced weight, and then the other baby is receiving most of the nutrients, and therefore you end up having a very big baby and a completely small baby. Okay, so very important to be able to monitor, okay, those the fetal growth, especially when it comes to twin gestation. Okay. The other thing importance is to guide, especially in obstetric interventions. Now, there are patients who come that trimester and they're having vaginal bleeding, okay, or they are telling you that the baby is not playing very well, and you need to do an ultrasound to be able to guide in interventions. Okay, so very important, especially for the clinician, to be able to guide and to be able to look at the fetal well-being and say exactly what needs to be done at that point. And then the other thing is to confirm for fetal maturity. Okay, now this is very important, especially for mothers who have undergone cesarean section, because if you have undergone cesarean section, most of the doctors will recommend for a repeat cesarean section. So of course, there are mothers who can actually try vaginal delivery even after cesarean section, but most of the doctors will not consent for a vaginal delivery because of its risk. Okay, so knowing the weight but also the fetal maturity, very important. Okay, so that you're able to determine when you might need to deliver this baby, and especially for mothers who do not know their last normal menstrual period. So very important to be able to know the fetal maturity, but also for mothers who have certain conditions like diabetes, others who present with hypertensive complications like preeclampsia and eclampsia, and the only treatment is to deliver. You can do an ultrasound to be able to look at the fetal maturity so that you can make important decisions when it comes to delivery. Okay. And then the last importance is for the peace of mind, especially for the mother, but also for the clinician. So that everyone is happy that the baby is growing well. It's always good for you as a mother to be able to just know that your baby is growing well and doesn't have any complications and everything is working perfectly. Now, if you have found this presentation very helpful, please consider subscribing to my YouTube channel for you to be able to and turn on the notification bell so that you're able to be notified every time we upload a new video. Until next time, God bless.